Hello, Assalamu alaikum. Welcome to Language Clinic channel. Now we are going to talk about heart attack in details. We will talk about the everything of heart attack. We will talk about the overview of heart attack, signs and symptoms of heart attack, the causes of heart attack, diagnosis and tests of heart attack. And we will also be talking about management and treatment of heart attack. Then we will talk about the prevention of heart attack. And next we will talk about outlook or prognosis of heart attack. And next, living with heart attack. We will be discussing living with heart attack and some additional questions, common questions, which will be very useful to everyone who is suffering from heart attack or who has a heart attack or whose relatives have already had a heart attack. So the question is, what is a heart attack? A heart attack is simply called in medical language myocardial infarction. A heart attack is an extremely dangerous condition that happens because you don't have enough blood flow to some of your heart muscle. This lack of blood flow can occur because of many different factors, but is usually related to a blockage in one or more of your heart's arteries. Without blood flow, the affected heart muscle will begin to die. If you don't get blood flow back quickly, a heart attack can cause permanent damage and oblique or death. A heart attack is a life-threatening emergency. If you think you or someone you are with is having a heart attack, call your nearby hotline number or visit your nearby hospital. Time is critical in treating a heart attack. A delay of even a few minutes can result in permanent heart damage or death. Now question is, what exactly happens during a heart attack? When a heart attack happens, blood flow to a part of your heart stops or is far below normal, which causes injury or death to that part of your heart muscle. When a part of your heart can't pump because it's dying from lack of blood flow, it can disrupt the pumping function of your heart. This can reduce or stop blood flow to the rest of the body, which can be deadly if someone doesn't correct it quickly. Now question is, how common is a heart attack? Every year more than 8,000 people in the US have a heart attack. Most heart attacks are due to coronary artery disease, which is the most common cause of death in the United States of America. Now let's going to be talk about signs and symptoms of heart attack. What does a heart attack feel like when you are having a heart attack? Many people feel pain in their chest during a heart attack. It can feel like discomfort, like squeezing or heaviness, or it can feel like crushing pain. It may start in your chest and spread or radiate to other areas like your left arm or both arms, shoulder, your neck, your jaw, your back, your down toward your waist. People often think they are having indigestion or heartburn when they are actually having a heart attack. Some only experience shortness of breath, nausea, or sweating. And now, what are the symptoms of a heart attack? How can you understand that you are going to have a heart attack? Heart attacks can have many symptoms, some of which are more common than others. Heart attack symptoms that people describe most often include: number one, chest pain, or which is called angina. Number two, shortness of breath or trouble breathing. You find trouble breathing. Number 3, trouble sleeping or insomnia. That means you cannot sleep properly at night. Number 4, nausea or stomach discomfort. Number 5, heart palpitations. Your heart will start pounding and palpitation. Number 6, anxiety or a feeling of impending doom. You are feeling that you are going to have a very coming distraction in your life. Number 7, feeling lightheaded or dizzy or passing out. Men are likely to have different heart attack symptoms. Women are less likely to have chest pain or discomfort that feels like indigestion. They are more likely to have shortness of breath, fatigue, insomnia that started before the heart attack. They also have nausea and vomiting or pain in their back, in the shoulders, in the neck, in the arms or abdomen. Now, what are the causes of a heart attack, or simply what causes heart attack? Most heart attacks happen because of a blockage in one of the blood vessels that supply your heart. Most often, this occurs because of plaque, a sticky substance that can build up on the insides of your arteries, similar to how pouring grease down your kitchen sink can block your home plumbing. That buildup is called atherosclerosis in medical language. When there is a large amount of this atherosclerotic buildup in the blood vessels to your heart, this is called coronary artery disease. Sometimes plaque deposits inside the coronary arteries. Coronary means heart. Coronary arteries or heart arteries can break open or it can rupture. And a blood clot can get stuck where the rupture happened. If the clot blocks the artery, this can deprive the heart muscle of blood and cause a heart attack. Heart attacks are possible without ruptured plaque, but this is rare and only accounts for about 5% of all heart attacks. This kind of heart attack can occur for several reasons. Number 1, coronary artery spasm. Number 2, rare medical conditions like any disease that causes unusual narrowing of blood vessels. Number 3, trauma that causes tears or ruptures in your coronary arteries. Number 4, an obstruction that comes from somewhere else in your body, like a blood clot or air bubble embolism that ends up in a coronary artery. Number 4, eating disorders, which over time can damage your heart and ultimately result in a heart attack. Number 6, anomalous coronary arteries. A heart issue you are born with where the coronary arteries are in abnormal positions. Number 7, other conditions that can cause your heart attack not to receive as much blood as it should for a prolonged period of time, such as when blood pressure is too low, when your blood pressure is too low, or oxygen is too low, or your heart rate is too fast. So, what are the risk factors for a heart attack? How can you understand that you can have a heart attack? Several key factors affect your risk of having a heart attack. Unfortunately, some of these heart attack risk factors are not things you can modify. Number 1, age and sex. Your risk of heart attack increases as you get older. Your sex influences when your risk of a heart attack starts to increase. For males, the risk of heart attack increases at age 45. For females, the risk of heart attack increases at 50 or after menopause. Number 2, family history of heart disease. If you have a parent or sibling with a history of heart attack or heart disease, especially at a younger age, your risk is even greater because your genetics are similar to theirs. Your risk increases if a first degree relative, biological sibling, or parent received a heart disease diagnosis at age 55 or younger if they are female, or at age 65 or younger if they are male. Number 3, lifestyle. Lifestyle choices you make that are not good for your heart can increase your risk of having a heart attack. This includes things like smoking, eating high fat foods, lack of physical activity, drinking too much alcohol, and drug use. Number 6, certain health conditions. Some health conditions put a stress on your heart and increase your risk for heart attack. This includes diabetes, having obesity, high blood pressure, high cholesterol, eating disorders, or a history of preeclampsia. Now the question is, what are the complications of a heart attack? That means if you have a heart attack, what other complications, complexities can happen? Complications associated with heart attack are: number 1, arrhythmias or abnormal heart rhythms; number 2, heart failure; number 3, heart valve disease or problems; number 4, a stroke; number 5, sudden cardiac arrest; number 6, depression and anxiety; number 7, cardiogenic shock; number 8, mechanical complications of heart attack such as ventricular septal defect or VSD or free wall rupture. These are more likely to happen with delayed treatment of a heart attack. So these all are simply about the heart attack, and in our next class we will talk about the diagnosis and the test that we have to do to understand that I am having a heart attack. We will also talk about the management and treatment of heart attack, and we will also be talking about how to live with a heart attack. And then we will also talk about what are the questions we should ask to our doctors. So wishing you all a good health and a good health. Last thing that I always say in my video is that always think positive, be positive. Try to exercise every day for 30 minutes in a week, at least 4 or 5 days, and don't lead a sedentary life, don't lead a lazy life, and psychologically try to be yourself positive and try to do civic engagement. I think this will help you. And if you enjoy listening to this lecture, please please like the video, or try to have a comment, or try to subscribe to this channel if you are new to this channel. If channel pleases you, please subscribe and try to watch other videos or try to listen to all other videos in this channel. Thank you all. Wishing you all a good health, good hygiene, and a good better future. Thank you.